IVs, there's multiple things that you need to know. You're not recording my face.
No, I'm not. No face.
For,
Boobs down.
Okay. For IVs, there's multiple things that you need to know. If this was on the Ousce, it could be multiple scenarios, or it may not be on the Ousce at all. So everything I say is all hypothetical, what ifs or what possibly could be. So for instance, for the Ousce, you could possibly be asked to start an IV. So you would need to know how to start an IV. You would need to know what equipment would need to be used to start an IV. So basically, if we ask you to just start an IV and not hang a bag, you would just put an adapter, which is this. This right here is a little adapter that would be connected to the IV if you were just asked to start an IV without hanging a bag. So to start an IV, what you would need to get is an IV catheter needle. This is an IV needle because it has a needle and a catheter. This is what stays in the patient. This goes in the sharps container. Don't recap needles, but this is all for demonstration purposes only. So you would take this, you would need this needle here. It's impossible to get it back in the case, but okay, here we go. So you would need one of these. You want to get you some 2x2s. You want to get a tourniquet. You would want to get tape. And you will want to get something to clean the site. These are alcohol pads. For IVs, they really use ChlorPrep. But for here, this is all we have, so this is what we would use. You will also get one of these little adapters. So you would take all of your equipment and get yourself prepared. You would set it there, get your gloves, and you would put the IV in and put in this adapter. Or you may be asked to hang a line for an IV that's already in place. So that means the IV part's already in. It already has an adapter. What we want you to do is pick out the correct fluid and spike and prime the line and connect it to the IV site. So to spike a bag, you basically would find the proper one, because if this was on here, it would be a whole container full of all different types of fluids. And some would be expired, some would have things floating in them. You would have to pick the correct one that's not expired, that is the one we asked you to hang, if that was on here. And then you would take this to spike it. You just lift this up, pull that off. Then you take an IV administration set, which is this. It would be in a separate bag. And you take this little pin that's inside of here, it's called a spike, and you just stick that into this part right here. That's called spike in the bag. Then you would have to prime the line. Right now, this is the flow regulator, flow meter, or this is what controls if the fluids are going to come in and out.
Which one is on and which one is off?
Down is off. Up is on. But sometimes it's also locked by this, because this also can control it, but this is used for a pump. So we usually don't use it unless you're connecting it to a pump, because this will go inside the pump to control it. So this is down, but to prime the line, what you would do is actually open this up and hang it over a trash can or something, and let fluid run all the way through to the bottom so that air does not go into the patient. Once you get the fluid all the way to the bottom, you'll close it back off. And then you would just hang this up here. The bottom of this will have a cap on it, and this has to stay sterile until you're actually connecting it to the patient. So if their IV was already in, you would just hold, put some pressure here, unscrew this part, and then just connect this, and then tape it down, and that's it. Or you may be asked to draw blood. Then you would just need to get the correct equipment. This is a blood collection needle. This is a tube holder.
So do we have to set an IV?
You possibly could have to start.
Can you
an
go
IV.
over that to just the process?
Yeah, I'll put one in.
Okay.
This is blood collection, so you would get all this stuff, get some 2x2s, and then you get your cleaning supplies and everything, a tourniquet, and then this is what you need to draw blood. But drawing blood is very easy. It's not too bad.
So in class, when we did it, we learned with two different.
This is also butterfly needle.
Okay, so are we gonna have?
You could use either one.
Okay.
Yes, and you actually can even start IVs with these as well. You just take this off.
There's one over there too. Oh,
Sorry. You can take that off and start an IV with that as well, or you can draw blood with it. But they don't use these unless they just absolutely cannot get an IV in, period, and they just want to give a bolus of something real quick. They'll use this. But for you, you would be using it for blood draws if you had to start a, do a venipuncture. So that's that. But to do the IV, so I'll just stick one in real quick. Okay, they don't have. So get you some gloves. I got all my equipment already ready. So let me use this arm because I actually like this one better.
I think this one might not work. I was trying to do this one, but for some reason the blood doesn't come out.
Oh no, these don't. These are from 2004, and they don't have a vacuum.
No, I was talking
in them.
about the little arm.
Oh,
There's
because
no blood coming out. I don't know why.
were you trying to do with this though?
No, I was just trying to do the IV thing,
Oh,
but there was no
okay.
blood coming out.
I like that one though. I just started one on there. I'll try it. Let me see. So basically, I already have my tape here. So you would need to get your tape ready and all that. So you take your tourniquet. So put your tourniquet on. You should put your tourniquet about 6 inches above the site you're going at. So you don't have to measure it or anything though, but just telling you, that's what they say. So you put your tourniquet on. It has to be able to be released with one hand. So you just want to do it really tight. And you basically just set it under there. So I found my vein. Okay, I want to go there. So you just take this, clean it, start in the middle and work your way out. Circular motion. You don't wipe down, go across, do any of that. You don't retouch it. If you do, you need to clean it again. But you just start in the middle, work your way out, and throw that away. Then you would just let that dry for a second. Have everything you need ready. So then you would just take your needle. This is trash. These are just the caps. You can throw those away. You always want your bevel up. And I actually hold my finger here so I can push this in with one finger.
What's a bevel up, man?
See the
Just
little
so-
hole?
yeah.
Bevel, where that's the bevel.
Okay,
You want to
so
have
put
that
that
up.
up, okay.
That's got to be face up. See the bevel? See
Okay.
the little hole?
Okay.
So then what you do is you want to stand this way because the IV needs to go up. So you can't put an IV in this way or this way. The vein is going up. That could also be on there. An IV could be in place this way, and you would have to notice that. No,
And say,
that's not right.
right.
Something's wrong with that IV. So that could be one of the things. But to start an IV, you basically just do this. You have your tourniquet on. I clean my site. So I've already found where I want to go. So hopefully we'll get some blood out of this thing. So you're just going to stick it in at about 15, 30 degree angle. And then you'll get flash immediately. So it's not in there. Don't take it in and out like I just did. I'm fine. This thing's been abused and beat to death.
Yeah.
Or, I mean, if you take it, you got to get a new needle if you...
Yes. Yeah. So I'm trying to find somewhere. There we go. So I got flash. So don't do this like I'm doing this, but this is how you would do it. You release this now. Then you start just pushing this up and pulling back. So the needles, then you want to put digital pressure and you want to have your adapter and you immediately connect it. Then I'm going to take me a piece of tape and then I'm going to tape it down.
Is it okay if we like stick it in and then pull it back out if we don't see blood? Is that fine, or would we fail because of that?
Try
Like, if we
not
don't
to
do
do
it
that
right.
because you're really fishing. That's what they call that.
Yeah.
And you shouldn't do that. In these, we'll give you a little bit of leniency because these veins are not real veins. And sometimes you're in the vein, but for some reason the blood just doesn't come out. So you'll get a teeny tiny little bit of leniency. But if you pulling needles all the way out, then just say, let me just get a new needle. But that's it. So then you would put this in a sharps container and then tape this down and, everything like that.
So this would be starting an IV?
This is